Hi everyone, my name is Alexa. Thanks for coming, or if you're joining us live on Facebook for this presentation. I'm a pharmacist here. I'm also a pharmacy resident for the year. So just kind of exploring the different areas of Sarasota and getting to know the hospital as a whole. But today we're going to be talking about hormone replacement therapy, and specifically at the end we'll kind of talk about, in honor of October Breast Cancer Awareness Month, the risk of breast cancer associated with hormone replacement therapy. After the end of the presentation, you will be able to define menopause and the symptoms associated with this, recognize the different hormone replacement therapies used to treat menopausal symptoms, and discuss the potential risks and benefits when using hormone replacement therapy. So to first understand why we use hormone replacement therapy in kind of that general aspect, let's talk about menopause. So what is menopause? It's a time in a woman's life when the ovaries stop working. So it could be due to age. Usually it's around 50 years of age. The woman starts experiencing that menopausal symptoms. You could have also menopause if your ovaries are removed by surgery for some reason, as well as there's many different other reasons the ovaries could stop working. And ultimately, when your ovaries stop working, they stop releasing eggs, and these eggs are what releases that estrogen and progesterone in your body. So looking at the chart, just to kind of give you a visual, you can see at the beginning of a woman's lifespan, around 18 years old, you have your highest levels of estrogen and progesterone. As it goes on, kind of as we age towards, as we get older, you can see the estrogen and progesterone levels tend to decline as we are aging. But dramatically, you can see this drop right here in the menopause area. And it's really these symptoms that are appearing because of the dramatic drop at that menopause age, which is usually, 45 to anywhere to like 60 years of age. And so this dramatic drop is really why you get those symptomatic issues that are so bothersome for a woman. But then after about 55, 60 and the woman has been tortured enough, your body will actually start adjusting at that time and adapting to your low levels, and you'll stop having some of those symptoms that are really bothersome. So why do we care about estrogen and progesterone? So there's many different reasons why we would care about these two hormones, because they have many effects on our body. Looking at directly comparing both of them, you can see some of them head to head. So like estrogen actually builds up your uterine lining, but progesterone is really important because it maintains that lining. You also have estrogen increasing the amount of body fat a woman has, while progesterone actually helps use that fat for energy. Estrogen also can have a depression effect, also is a huge trigger for migraines for women, while progesterone actually has an antidepressant effect. Also looking at estrogen, it can interfere with thyroid hormones, which could also be problematic for women as well, while progesterone can help facilitate that normal action of thyroid in our body. Looking back at estrogen, it has been associated with increasing blood clotting within women, while progesterone can actually help normalize that blood clotting process. For estrogen, it can decrease libido for women, which is pretty much your sex drive, as well as progesterone can actually help restore that and normalize that as well. And lastly, I have estrogen can impair blood sugar control, so just the amount of blood sugars in your body. Also, the progesterone can help regulate that too. Now, it kind of looks like progesterone is really good, right, compared to estrogen. It is in moderation. There's always the benefits and risks of having too much of one and not enough of the other. So it's really important that within our bodies, as you can see from the chart before, it had a certain level of both estrogen and progesterone to help make sure the woman can normalize properly. So let's dive to actually using hormone replacement therapy. So most of the symptoms associated with menopause are actually due to the lower levels of estrogen. These could be symptoms like hot flashes, sweating, those are probably the most common ones. You also can have vaginal dryness and changes in mood or libido, which is that sex drive. And these are pretty much those really symptomatic menopausal ones that most women complain about the most. You could also hear people describe hormone replacement therapy as postmenopausal hormone therapy or postmenopausal hormones. There's many different terms, hormone replacements, hormones, there's many different terminologies. So it's really good to be familiar with the different terms that they use to describe hormone replacement therapy. There's pretty much three main categories you could use to treat your symptoms of menopause. And there's many different types within these three categories, but mainly you can have estrogen-based products, which have different names and terminologies when you look at the package for the active ingredient, but could be also known as conjugated estrogens and estradiols. You also have progesterone, which is also known as progestins. It's pretty much the same thing. It's just how they're made in the lab. And then you also have combination therapy, which is estrogen and progestin therapy. So it's really three main categories that you could use for hormone replacement therapy. So let's first talk about estrogen therapy, because that's kind of our main one we want to replace, as that's what's really causing those symptoms associated with menopause. So unfortunately, estrogen does have an increased risk of cancer of the uterus, which is also endometrial cancer. So if you remember me talking about it before, estrogen helps build up that lining in the endometrial part of your body. However, progesterone is what maintains it. So it's only safe to take estrogen-only therapy if you don't have a uterus, because then you don't have the ability to maintain that lining and protect it. So that's why it's associated with endometrial cancer. Side effects with estrogen therapy, because not all drugs are benign or not only helping treat the symptoms, would be swollen breast, vaginal discharge, headaches. As I said, it's a really big trigger for migraines and headaches for women, and nausea. Here are some examples, some common ones that we see women take a lot, and also a picture of the estradiol cream you could use locally for some of those symptoms. Moving on to your progestin-based therapy. This is actually safe for women with or without a uterus. So again, this is what helps maintain that uterine lining after estrogen helps build it up. And so if a woman does not have a uterus, they can use this with or without, unlike the estrogen where you really only want to use that if you don't have a uterus. Side effects associated with progesterone therapy, you can see some bloating, mood changes, and nausea, of course. And then here are some examples as well of some of the agents commonly used for progestin therapy, and just a picture as well. And just a note, you can see in the picture how it says Provera, but then underneath it's like says medroxyprogesterone. I know it's really small font, but that is technically a different type of progesterone. There's many different names. You might see, acetate at the end, but as long as it has that core progesterone in it, that's how you know it's progesterone therapy. Our next category, moving on, is the actual combination therapy, having estrogen and progesterone therapy. So the progesterone is actually added to the estrogen therapy to help reduce that risk of uterine cancer in women who still have their uterus. So again, just emphasizing, if patients don't or still have their uterus and they want to use estrogen therapy, then you would add this progesterone on to help maintain that lining and help decrease the risk of endometrial cancer. So this is really given in two ways. You first have your continuous, which is pretty much saying you're taking the same amount of estrogen and progesterone every day, so the same amount every day. You could also take it a cyclic or sequential way, which actually helps more mimic the normal processes and release of hormones a woman normally does in their body. So this is going to mimic more of the natural way versus your continuous, you're just continuously taking hormones the same amount every day. However, the sequential is, or the cyclic sequential is associated with more vaginal bleeding versus the continuous, you won't see many menstrual bleeding or any breakthrough bleeding with that. So there are your pros and your cons with that. Here are some examples, and you can see in the picture, it pretty much looks like a birth control pack, and that's pretty much what it is. Using it more towards the menopausal symptoms versus the birth control part of that. because we're talking about hormones, I had to talk about all of our over-the-counter, our natural products, our bioidentical hormones, because this is a really big hot topic, and I know probably you guys have a lot of questions with this. So our first category, kind of looking into the more natural products and not prescription-based products, is our bioidentical hormones. And really it's the same thing as estrogen and progesterone, but this chemical structure is actually found naturally, so maybe in a plant-based form versus manufacturing it and making it in a lab. So over-the-counter products, they're really described as natural by some of these healthcare experts. Unfortunately, along with pretty much all the herbals and supplements that we'll be talking about moving forward, there's no long-term studies with these. They still have the same health risks as any type of other hormone. It's a hormone, you're putting it in your body. Still the same risks, except for we actually don't know the true risks and the problems associated with these because they are not studied. Here are some examples that you could possibly see for bioidentical hormones. Again, there's hundreds of them out there, all the way across in Europe too. So always be wary when you see a bioidentical hormone or something over the counter that says, found naturally hormone. It's pretty much still a hormone. Moving on to herbs and supplements. So these are the, again, over-the-counter possible natural hormone therapies that are available, and they will promote themselves as being helpful with menopausal symptoms. So these could be vitamins, some soy-based products, and herbals. I'm sure you guys all know the yams. This would be falling underneath that herb and supplement as well, and the bioidentical hormones. These are considered dietary supplements, not drugs, just an FYI. And these are not prescriptions. Again, these are over the counter. Unfortunately, with these herbs and supplements, these are not studied as well. There is no study on these. It's not FDA approved. You do not know what actual product you are getting within the product because it is not studied and standardized. So there is a potential to interact with other drugs and cause unexpected problems. So it's really important you're always discussing with your pharmacist or your physician that you're considering taking over-the-counter products to make sure it doesn't interact with any of your other drugs and cause you other problems you didn't foresee coming. And some examples could be black cohosh, red clover, estrologio, just to name a few, and I guess yams, of course, too. All right, and so the best thing about hormone replacement therapy is there's many different formulations and ways that you can take hormone replacement therapy. So the first one you could consider taking kind of route is oral. So that could be through tablets or capsules. And really this will enter the bloodstream and circulate to reach all parts of the body. And specifically, these are really great to help treat those hot flashes and night sweats. You could also use topical, which I always recommend for patients because this is only a local treatment for those symptoms, such local treatment there where you don't need to enter and reach all parts of your body. It's really just that certain area that's problematic. And these could be creams, vaginal rings, and even tablets that are inserted vaginally. And specifically, you'd want to use topical to help treat dry or thinned vaginal tissue that's really discomfort. You wouldn't really want to use total systemic if those are the only symptoms you're having, so then you're not exposing your body to all these hormones, just locally. Other routes you can see would definitely be the bloodstream circulating to reach all the parts, would be injections, which could be in the muscle or under the skin. There's also skin patches out there, which is actually absorbed through the skin and still reaches all parts of your body. And then there's also vaginal rings that still release enough where it can reach the entire body as well. So if there's pills that you can't stand, or if there's non-compliance and you always forget to take your pill, the patches might be a great idea, or vaginal rings too. So there's many different formulations and options to help treat you and your symptoms personally. Now let's get to the nitty-gritty of what everyone wants to know. What's your risk of breast cancer with all these hormone replacement therapies? So there was a huge study that looked at it was called the Women's Health Initiative, that looked at kind of what is your risk of certain cancers when taking hormone replacement therapy. So we first can see that estrogen therapy is actually not linked to a higher risk of breast cancer. However, I am going to put the disclaimer out there. They did notice at a follow-up study that after 10 years of receiving estrogen replacement therapy, they were at a higher risk. So you are at a higher risk after 10 years of estrogen therapy. But normally, as we'll discuss, you don't really want to treat and use estrogen therapy for more than 3 to 5 years. You want to try and make it as minimal as possible. Of course, if your symptoms for menopause are, very bothersome and affecting your daily life, then of course it's a base-by-base risk versus benefit. But you'll see that you really want to try and use it as minimal as possible. So more than 10 years, it is linked to an increase in breast cancer, but for this purpose of kind of the menopausal symptoms, it is not. And also with estrogen therapy, it's actually associated with an increase, we were kind of talked about it, with the endometrial cancer, especially if you use estrogen therapy alone because of the uterine lining. And then ovarian cancer was at an increased risk as well with estrogen therapy. All right, progesterone therapy now. Just progesterone therapy use. Progesterone therapy as well was not linked to a higher risk of breast cancer. And it actually was associated with a lower risk of endometrial cancer, which you guys should already know because we know we added on to estrogen therapy to help with that protective, especially if the woman still has a uterus. Now, unfortunately, based on these huge women's health initiative studies, we can see that a combination of estrogen and progesterone therapy is linked to a higher risk of breast cancer. It's been shown that the longer that you use the therapy, the higher the risk. As why we kind of just discussed, you want to use the shortest amount of time possible so you kind of can avoid this risk. They did kind of show in about 2 to 5 years after stopping the hormones, you went back to your baseline risk of what you were prior to starting the hormone therapy. So once you do stop, your risk is not continued. More importantly, with the estrogen-progesterone combination therapy, you can actually see there is a link. It's linked to an increased breast density. And this is important because how do we detect breast cancer? Through mammograms. And if your breast density is increased, then it's actually harder to detect those lumps and the imaging to see if you actually have breast cancer. So that's important because, moving forward, your risk might not be high anymore because you don't use it. But if you had an underlying high risk and now you can't see it on imaging, that could pose a risk for catching early detection. Looking at our favorite over-the-counter herbals, bioidentical and natural therapies, we kind of already discussed how these are not studied, these are not FDA approved, so there is no known studies that are showing or even looking at if these are linked to breast cancer because they are not FDA approved and not tested. So just putting that warning out there that you do not know if they are increased risk or not, and they are still hormones. So that kind of begs the question, should I use hormone replacement therapy? So really this decision needs to be made by you personally and your physician, and really weighing those risks and benefits. So what's your baseline risk of breast cancer? What's your risk? What are you willing to risk for some of those symptomatic reliefs of the menopausal symptoms? Also, it's important to look at other serious conditions affected by hormone therapy because not only can it be increased risk of cancers, but they also have their other own side effects that we have to worry about with hormone therapies. Also, it's more importantly, how bad is the menopausal symptoms? Is it affecting your daily life? Do you wake up every night in sweats and you're losing sleep and you're not enjoying daily pleasure and you have very bad vaginal dryness? It's important that you are kind of analyzing how bad is affecting your life and whether you need to take treatment to help manage these symptoms. Also, looking at other alternative medications to treat menopausal symptoms. I know that there's an antidepressant out there that's actually shown to decrease the frequency of hot flashes. Is that something you and your doctor may be willing to try and give a test trial with that? Always asking what are other options just, besides hormone replacement therapy. So patients really who should not use hormone replacement therapy, of course, this decision is, again, based on you and your physician's decision. But normally we kind of want to steer away with patients using hormone replacement therapy if they have uncontrolled hypertension, or high blood pressure. If they have severe migraines, as we just kind of said, that estrogen really is a huge trigger for migraines. If you are known or have blood clots, if you're known to always get blood clots or be at risk for these, this is a huge contraindication. If a patient has a history or has a stroke, any heart disease or severe heart disease, I should say, and again, if they have a history or current endometrial, ovarian, or breast cancer. Really weighing the risks and benefits with these, but you really kind of want to steer away with these indications right here. Of course, there's always safer alternatives to hormone replacement therapy, and it's shown that there's safe and healthy ways to help manage menopausal symptoms, such as exercising, trying to reduce stress, getting enough sleep. I know that's always hard for everyone. Avoiding hot flash triggers is a huge one, so avoiding those hot foods, soups, coffees, teas, any alcohol too, anything that's going to make you really flush, try and avoid those. That's an easy way to try and avoid the hot flashes. Quitting smoking is a huge one as well. And then other medications, as we discussed, could also help or could possibly trigger menopausal symptoms, as well as could use to treat like the antidepressant with the hot flashes. So looking at considerations, I know looking at the presentation you might be thinking, why not just use progesterone therapy? It looks like it's safer than estrogen therapy, and it doesn't have so many associated risks with it. However, with the progesterone therapy, a lot of women find that it's not actually helping the symptoms, unfortunately. It's really that estrogen base that you lost through menopause that's really causing all those symptoms. And progesterone therapy offers that benefit to add on to estrogen therapy, so you can kind of reduce that risk of that endometrial cancer and kind of give that balance so you're not using so much estrogen. But then, of course, now you have that increased risk of other cancers, such as breast cancer, when you put it in combination. So it's really a risk versus benefits. I'm going to keep saying that the entire presentation. But using the lowest dose needed for the shortest amount of time. It's really trying to bridge you over from that pre-menopause to after menopause state. So if, you know, every woman is different, how long they end up having menopause for and those symptoms. So really just trying to get you to that bridge over to get into the clear of not having those symptoms anymore. So using the lowest and shortest amount of time possible. Seeing your doctor regularly is important so they can monitor how you're doing, and more importantly, if the medication isn't working, why are you still using it? You know, making sure you can find the best medication for you. Also, making sure that you're reporting any vaginal bleeding that happens after menopause. It's important to have that discussion with your physician, and perform regular self-breast exams. Of course, since it's, you know, Breast Cancer Awareness Month, I'm just going to touch base a little bit on the, you know, self-breast exam portion of this. So why would we want to do self-breast exams? 40% of diagnosed breast cancers are detected by women who feel a lump. That is almost half of breast cancers being detected by you guys at home. It's important to become familiar with your breast beyond the self-breast exams, because this is how you can early detect breast cancer. It could be just as simple looking at your breast, seeing if there's difference in appearance, touch, the way it feels, even if the little dimples versus hardening or any ulcers. This is a huge way to find out, you know, kind of your baseline and how it's changed over time. And this is more importantly too, that you need to make sure that you're familiar with your baseline breast image, you know, appearance and, you know, feel of it. Because after hormone replacement therapy, that's an easy way for you to know if something has changed after using therapy. So when should you perform these self-breast exams? At least once a month, and try and be consistent. So if it's every day after your period, or the last day after your period, or if it's the first day of the month, making sure that you're just consistently doing it at the same time. Where they recommend in the shower, in front of the mirror, because you can really see if any of the appearance have changed, let alone, you know, internally, and while lying down. That way, when you do lie down, your breast tissue can actually flatten over across the entire chest wall, so you can really get a feel for the entire breast tissue in there. And then what do you do if you do find a lump or something abnormal? Stay calm. It's actually been shown that 8 out of 10 lumps that are found are actually non-cancerous, so that's really good. But just schedule an appointment with your doctor and let him know these changes. So really, it's important to always have an open communication with your physician and your pharmacist, wherever you're filling your prescriptions. Really ask the purpose of the medication. What are you using it for? Specifically with hormone replacement therapy, what symptoms are these medications actually going to treat? Also, is there any warning signs that the medication is not working or causing certain side effects that should not be happening? Especially like estrogen with like blood clots. Making sure that you're using the medication appropriate is very important. Making sure that you're not overusing the topical creams. Only using the little pea size locally is important, because eventually, yes, it is locally and it doesn't absorb within your entire body. However, if you use too much in a certain area, it can start absorbing internally and actually reaching other sites of the body. And then, of course, looking at side effects. What are possible side effects of each medication you're taking? And really, the drug interactions is huge, especially with those over-the-counter herbals, natural products that claim that they have hormone properties. Those are really important to always discuss with your pharmacist before taking any other medications that you're using, like such as prescriptions, so you can avoid drug interactions and any possible problems that could be associated with those over-the-counters. So I know we kind of briefly talked about everything and kind of touched base on a little bit of everything, but I'll open up the floor to you guys for any questions.
How does hormones affect the bones?
Oh, yes. So another added benefit of hormone therapy, which some patients could be on without the menopausal symptoms, is actually osteoporosis. So estrogen actually has a protective property, as well as not only preventing osteoporosis, but it can actually treat osteoporosis. So those are sometimes some issues that happen around menopause age area, not so much because of menopause, which it could be, but just around that age of osteoporosis happening. Sometimes physicians will want to put estrogen therapy on board just to have that treatment and the prevention of more loss of the bones, which is, again, you have to kind of weigh your risks versus benefits of putting patients on these therapies.
Yeah, I had a total hysterectomy when I was only 28 or 29. And so I was in HRT for a while, long time later.
Yeah.
But now I do have osteoporosis, and it's probably because of...
Yeah. Yep. It's because of the lack of hormones.
Yes. I
Yes.
was too young.
Yes.
So now I'm getting Prolia. Somebody told me that it has some hormones. Is that true?
I
That's
think...
every
No, that's
6
the...
months.
Yeah. I don't think it totally does. Let me double check that. I don't think it really has that many hormones. Let me double check that.
I know somebody told me that they cannot use it in men because of it has some hormones or something.
Yeah, no, it doesn't.
It doesn't?
Mm-mm.
Okay. All right.
Nope.
I don't have to worry about that.
Yep. Nope. It just works directly on the bone.
Okay.
Yep. Any other questions? You can always come up afterwards to me privately if you have any questions as well.
So you show a chart at the beginning. About menopause, you know, that it comes between 45 and 50, that one. So she had a total hysterectomy at, she was 28, so that moves all the way
Yep.
to
Yep.
here, and then the effects, and then you measure taking estrogen and something else. I don't remember if she took estrogen,
Mine was just estrogen.
but she said if there was a total hysterectomy, it had to be balanced with something else.
Yeah, so this is kind of like the normal menopause that a patient would go through if they just naturally went through menopause with your ovary stopping, not releasing eggs anymore. of course, like you were saying, if you have a total hysterectomy at age 30, then your menopause shift will move all the way over here, and your curve will naturally flatten out through this time period. And it's really this menopausal part with your body adapting from this high levels of estrogen and progesterone to a dramatic decrease. And that's that symptoms that you're really experiencing, because that's what menopause, the problem with menopause is. It's really the symptoms. Going from, I used to have progesterone and estrogen normally released in my body naturally, to now I'm not producing any. And it's the symptoms that are problematic. So that's really why, women want to take that estrogen and progesterone hormone therapy. Now, if, a woman has a hysterectomy and she takes it a little bit because she's trying to get through those dramatic, and usually when you do have a hysterectomy, they'll kind of bridge you over because they're forcing you to go through menopause in a way. But really, you're only going to start using the hormone therapy kind of towards the end is because of osteoporosis or some of the other associations with lack of hormones releasing in your body.
But listen, you took estrogen, but progesterone also, because
No, just estrogen.
so
It was a Premarin.
Yeah, Premarin is just estrogen.
and I remember her, she had her.
And sometimes
her
they do
flashes.
take progestin and estrogen therapy. Again, that really mimics what your body is normally doing naturally, so it feels a little bit better. Than sometimes patients have wild mood swings when they take estrogen therapy and they can't handle it. So really balancing the progestin and estrogen helps also the side effects of estrogen therapy sometimes. So that's kind of why you would want to add progesterone on. Or if you have a uterus, you need to protect that uterus if you're using estrogen therapy. Any other
You're
questions?
very good. You're fantastic.
All right. Again, I'll be here for a little bit afterwards, just in case you have any questions privately. All right. And there's many resources out there. Many resources.